Preparing patients to care for themselves at home after same-day surgery can be very complex. Patients are discharging faster than ever before and expected to self-manage what was previously an aspect of care provided by professionals. There is limited time to educate in the fast-paced same-day surgery environment. It is a challenge as a perioperative nurse to make sure your patient has everything they need to care for themselves at home to prevent readmissions, promote optimal outcomes, and positively affect the patient's experience. Knowing the challenges perioperative nursing faces, our team decided to do a deep dive into evidence-based practices for discharge teaching and patient experience. A literature review was conducted. We also completed a staff survey assessing nurses' confidence in discharge teaching and understanding of current practices. Press-Ganey scores were also reviewed. Top box score is the percent of patients who rank a facility very good on a 5-point Likert scale. Percentile ranking is the comparing to like facilities. Our Press-Ganey satisfaction scores for the questions instructions regarding recovery were consistently low, ranging anywhere from the 2nd to 20th percentile. Our overall top box scores were around 83%, which put us in the 25th to 26th percentile when compared to like facilities. After reviewing best practices, completing our survey, and looking at Press-Ganey scores, we knew we had the opportunity to make an improvement. Through our literature review, we found that about 35% of Americans have only basic or below basic health literacy skills. Health literacy is the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Our team decided to create a new and simplified discharge education sheet. This sheet includes the most common risk factors that might cause a patient to be readmitted post-surgery, which are all areas that are asked about on Press-Ganey: bleeding, nausea, vomiting, infection, and pain. The sheet was reviewed by many non-medical people from the age of 12 to 85 to help make it understandable by all. Along with our new discharge education, we implemented the Commit to Sit initiative. Commit to Sit refers to the process of getting to eye level with the patient and family member to provide undivided attention and eye contact during communication. The undivided attention is very important, not multitasking, not doing other things, but sitting and only focusing on education. Data shows patients who are more satisfied when their caregivers spend time sitting with them. Sitting instead of standing when talking with patients is perceived as more time spent at the bedside. Quality of time is more important than quantity of time. One comment frequently seen on Press-Ganey in the same-day surgery environment is, "I felt rushed." Our hope was by implementing Commit to Sit and focusing on sitting down with the patients and taking uninterrupted time for teaching and active listening, patients would not feel rushed. The expectation set was staff were to take time to sit and educate every patient and caregiver pre-op with our new discharge instruction sheet, as well as going over the surgeon's specific education. Again, post-op, the same nurse would take uninterrupted time to sit and review education with the patient and caregiver. Multimodal teaching is key. Verbal, written, demonstrations, teach back, whatever the patient needs to be prepared. This is an expectation with every patient every time. Studies show that when implementing Commit to Sit, there will be a decrease in readmissions, less time will be spent re-educating families, since the communication is intentional and concise. Patients and families will be more likely to recommend the hospital if they felt they were listened to. This will result in improved patient satisfaction, improved perception of care, builds customer loyalty, ensures consistent delivery of services and respect, reduces patient and family anxiety, and increases patient compliance and improves clinical outcomes. Since implementing our Keys to Successful Recovery initiative in October of 2023, our Press-Ganey scores have greatly improved. As I said prior, for the question instructions regarding recovery, when compared to like facilities, we ranked anywhere from the 2nd to 20th percentile. In the 6 months after our initiative went live, we've ranked anywhere from the 21st to the 83rd percentile. 5 of the 6 months, we have been in the 68th or greater percentile. Our overall Press-Ganey scores pre-implementation were the 25th and 26th percentile. For the 2 quarters, which is 6 months post-implementation, we increased to the 30th and 68th percentile. The combination of developing easy-to-understand education and the initiative of taking the time to sit and educate our patients in multiple sessions has increased our patient experience and thus increased our patient satisfaction scores. Committing to sit allows patients to feel heard. This increases patients' trust in their health care, compliance with treatment, and perception of holistic care. Patients are more satisfied with their instructions regarding recovery and are prepared to care for themselves at home successfully.